Good morning and welcome to the PT on Ice daily show. Um, I feel honored and privileged to be a part of Clinical Tuesday. My name is Dr. of Physical Therapy Lindsay Huey, and I am lead faculty for extremity management along with Eric Chacotes. So get those courses scheduled in for the rest of 2020 when you're able, and then in 2021 we are also booking dates. So again, I'm so excited to be here with you and repping some new ice swag. And today we're going to talk about plantar fascia health and resiliency and how that really comes through loading our patients well. So let's first just kind of identify the problem I often see in clinics around the country and your everyday PT. Under-dosing and unindividualized dosing. So let's first define plantar fasciitis. So that's what it's commonly termed. And when we think of plantar fasciitis, we're talking about the patient complaints of pain at that medial tubercle of the calcaneus. It's those first few steps in the morning where pain is the worst, or after rest. Prolonged standing can cause some pain. And then as the day wears on, pain is getting worse. And so just to review some of the prevalence rates, when you're thinking about this in comparison to low back pain and knee pain, this ranges from 3 to 6% of that population that's presenting to outpatient. So it's relatively low, but this is a very debilitating condition. And so it affects people's daily life. It affects their willingness to be social. It affects their footwear choices and just overall foot health. But the astounding number that I want to share with you is that 40% of that 3 to 6% will go on to having pain for up to 2 years. 40%. That is an astounding and disappointing percent. And it is our responsibility and job as physical therapists to do better. And load and dosage is something I'm super passionate about. And when I'm teaching my students at South College, and when I'm teaching around the country, that's something that I really, really harp on, because we can do better. And it's exciting. It makes our job a lot more exciting than 3 sets of 10. And specifically in this population, you'll see a lot of ankle four-ways, towel crunches, marble pickups, and slant board and hip four-way. And while those can all be effective, they are not reaching that 40% prevalence. And so we do know that prevalence is a tiny bit higher in those people that are more active. So think about your runners or your CrossFitters. And so why I even picked this subject at this time is that you have a lot more people staying home, which is resulting in one of two things: either being a lot more active than they were, or a little bit more sedentary. And so those are two kind of risk factors that kind of jumpstart this plantar fasciitis. Now, I keep saying plantar fasciitis, and for those that are keeping track of what recent literature says, and what we mainly see in the clinic is people coming to us later, 3+ months later of pain, which we know is not really an itis. It's more an osis. So it's also known in the literature as plantar fasciosis or fasciopathy. And why that matters is we can't treat this like an itis. It's a degenerative condition. And so we need to induce load at that emphasis of the plantar fascia to promote wellness and foot health. So specifically today, and why I'm leaning in is because I love talking to you guys, and plus I need a good camera angle for when we get to all these props in the background, because I'm actually going to show you some of my favorite exercises for this condition. And I specifically base this off of Rathlet et al. And I'm sorry, buddy, if I botched your name, but I'm a big fan of your RCT, because this randomized control trial compared orthotics and stretching and high dose loading and orthotics. And this was a long-term follow-up. So they looked at patients at 1, 3, 6 months, and 12. And so actually the greatest benefit was seen when you compared the two groups at that 3-month window. And the reason I bring that up before I actually get into the exercise is that I find a barrier often with this condition is time and expectation. So our patients, they come in expecting to be pain-free yesterday. They want that quick fix. And so you have to really address right away the expectation is this is not a quick fix. And also letting them know that you are their guide. You're not that knight that's going to come in and do all these manual therapy techniques to make this go away. You're a shepherd. You're going to guide them along the path and help them load appropriately. And we always say, begin with the end in mind at an initial evaluation, which means I'm talking about load, even if they're highly irritable, meaning high pain levels and severely affected in all activities of daily living. I'm still having that initial conversation that load is important. Load is necessary for you to ultimately heal, which then that puts that onus back on them to take responsibility for their foot health. And patients want to be challenged. They want to know what to expect, and they want to know the time frame. So if you can give them that, you're going to be successful. And this applies not only to people with plantar heel pain, but for all conditions. So now it's time to get up and move a little bit. And I want to show you Rathlet et al.'s protocol and what he did specifically to load this plantar fascia. And so I'm going to step back here. And for people that are just listening and not able to see me, the setup for this is you'll grab a towel, okay? And you're going to roll it up. And so I'm going to show you exactly as the RCT did this, and then I'm going to show you some variations that I use in the clinic. So you'll fold the towel and you'll roll it up. And what you really want is we want to load that plantar fascia specific. So when I first show you this exercise, it's going to just look like a unilateral heel raise, but that's not what it is. It's a plantar fascia raise, because by inducing toe extension or dorsiflexion, however you call it, we're using that windlass mechanism. We're putting more tensile load through the fascia. And for those biomechanic nerds, think back to the windlass mechanism and look up in your books or on your apps to see what that is if you're not familiar. But you need to be by a surface that is stable, so whether it's a wall or a PVC pipe, and ideally this is done unilaterally. So you're going to be off the step, toes are extended, and then you're going to push through and then slowly lower. And it's actually 3 seconds of the concentric phase, 2 seconds isometrically at the top, and then a 3-second eccentric, so lowering. And so I'm going to show you that one more time, and then we're going to talk about rep scheme and how to progress load a little bit. So again, toes are extended, and then I'm going to lift all the way up. And it's really important that you get that full range and that the toes stay extended to get that strong load through the fascia. What Rathlet et al. Did in that RCT is he recommended every 2 days that you start with 3 sets of 12. And ideally it starts out unilaterally like I just showed you. And then you're going to progress at week 2 in sets, so 4 sets, but 10 reps. And you're actually going to add some load. So I think that first way I just showed you is just load of your body weight. And let me tell you, that is uncomfortable in and of itself. It requires balance. So for your patients that are older and there's falls risk involved, you might need a more stable surface, and it might need to be bilateral upper extremity support. And then for those highly irritable patients that you want to start loading, maybe it's just the towel roll on the ground and not on a step. So what that would look like is you start and you roll up this towel, and you don't really need to see that on camera, but for effect. And maybe it's just here, but still going through that full range. So in that, after 2 weeks, when you progress to that 4 sets of 10, what Rathlet et al. Actually recommends is loading up a backpack full of books. So pick your favorite book, whether it's Brené Brown, Dare to Lead, or some Mark Ripito, whatever your nerdy pleasure is. You'll load it up in your book bag. And then you're going to do the same thing. Ideally, you'll be on the step. You'll have a firm support. And you're going to go all the way through that motion. And so the rep scheme is 4 sets of 10. And then after 2 more weeks, you're going to go 5 sets, 8 reps, and you're going to put some more books in your book bag. But think about what you have in your clinic or what your patient's lifestyle is like. If they're a CrossFitter, maybe they have a weighted rucksack or a weight vest. Maybe if it's a patient at home and they have some kind of weight or a gallon of milk, they can just grab a dumbbell, that gallon of milk, and do the same exercise. And for those that aren't viewing, I'm kind of giving a visual demonstration off the step, holding onto a dumbbell in my left hand. But be creative with this. This is where our jobs get fun, and we can be very specific to the patient. If it's, Aunt Ethel, and she is having trouble just going up and down the steps and doing laundry, maybe we're doing this with a laundry basket. And maybe we're not on this high of a step, but we're loading through that towel. And that would look like me holding a laundry basket like I am, for those that are just listening. And hopefully you're getting a little good laugh about all my props. But all jokes aside, what's important here is your ability to promote expectation and time. So meaning, you're not going to see the benefits of this right away. You're looking down 2 to 3 months where you're noticing you can walk a little longer or stand a little longer without pain, or that those first few steps don't take as long to shake off that pain. In addition, you're being willing to let the patient regress this. I showed the most advanced stage of this exercise, which is off of the step and loaded. It's okay if you have to start with 2 legs, and that's what they did in the study. For people that couldn't tolerate the 1 leg, they did bilateral. And often we're seeing patients that have bilateral symptoms. And so that that is another challenge that you have to adjust based on the individual before you. And so the guidelines I usually give to the patient, so if we're thinking NPRS, we want that somewhere between a 2 and a 5 out of 10. I don't want you getting to that 6 out of 10 or exceeding it. So thinking about tendinopathies and loading, there are tendons under that fascia, so we can still use that scale. Or if you're using RPE, you can use that and say, I want you, Mrs. Jones, between a 7 and an 8 on this scale, all right? Kind of moderate difficulty. Or if you're using reps in reserve, which I really love to do for when we're loading with weight, you should have about 2 to 3 more reps in you. So as you progress through that rep scheme, you really have to target it to the patient. So even though Rathlet et al. Claims that you should do the 3 sets of 12, maybe your patient can do 6 reps, and that's okay. But you're making them successful. You're giving them those guidelines about the pain scale or what they should expect. And I always tell patients, this is not the most comfortable, and that's okay. And so my challenge to you is be creative in your dosage, make it individualized for the patient before you and their goals. And so think about, your older patient that is 60 to 70 and how you're going to load them differently than your CrossFitter. And I happen to work in a space at a CrossFit gym, so that's why I'm referencing that a lot. They want that challenge. But I will tell you, they want the challenge sooner, right? But all patients ultimately want to be challenged. They want to know expectation and time. So if we can give them that, we will be successful. And so at a time right now in general, with general uncertainty with the COVID-19, we have this really cool opportunity right now, and with any patient retreat, any body region, to really elicit hope, reassurance, and giving them a game plan. So that's what excellence in extremity management looks like, and I hope monthly to be sharing with you special topics about different extremities throughout the body. So again, I am Dr. Lindsay Huey. I am lead faculty for extremity management for ICE. I appreciate your time and attention this morning, and I will post that article if you guys are interested. Cheers and happy Clinical Tuesday. Hi guys, bye guys. I like the waves.
Hey, thanks for tuning in to the PT on Ice Daily Show. If you enjoyed this content, head on over to iTunes and leave us a review. And be sure to check us out on Facebook and Instagram at the Institute of Clinical Excellence. If you're interested in getting plugged into more ICE content on a weekly basis while earning CEUs from home, check out our virtual ICE online mentorship program at ptonice.com. While you're there, sign up for our Hump Day Hustling newsletter for a free email every Wednesday morning with our top 5 research articles and social media posts that we think are worth reading. Head over to ptonice.com and scroll to the bottom of the page to sign up.